I've come to the conclusion that every woman has PCOS until proven otherwise. Younger girls will complain of acne, excess hair growth, difficulty losing weight. They're inflamed, they're having irregular periods, very bad menstrual cramps. Those are signs of PCOS. Not to mention, later on, the issues with infertility.
How long can a woman go without realizing that she has PCOS?
A very long time. If one thing a woman who thinks she has PCOS can do is treating.
They're in like their 20s, early 30s, and they're gonna be like, I got like 10 more years before I have to start worrying about this stuff.
What I do now, as a teenager even, I'm gonna pay for later on in my 40s, 50s, and 60s. Women spend the last 30 to 40 years of their lives feeling like something isn't right. Average age for menopause around 52. It can start as early as age 35.
15 years before?
15 years.
How did our culture feed into these problems?
If a woman is having issues with intimacy, it's not something that she's going to talk about. It's going to be looked down upon. Why are you talking about this? Why are you asking about this?
What are the lifestyle changes that they have to do?
Well-balanced meals, increasing protein and movement. Movement is medicine. Decreasing bread, rice, potato, sweets, and pasta, all the good things. We weren't created for the lifestyle that we have. Your body is giving you a signal that something is off. You need to change something that you're doing, or you need hormone replacement therapy. Your symptoms are real. I think if anyone takes one thing away from this, it's
I just had a small message for you before we start today's episode. Thank you for coming back, listening to these episodes again. It took some time to fine-tune some of the details, but hopefully from here on out, it'll be nonstop. Christina's a hormone expert, and everything we talk about, whether it's from women's hormones to men's hormones and the way that they affect day-to-day life during women's perimenopause and menopause periods, or when they're going through PCOS, or whether it's men that have low testosterone that want to increase it, we go through it all. If you're a woman, you're really going to enjoy this conversation. And if you're a man, there is a lot to learn. One thing I want to ask from you guys is subscribe if you haven't yet, like this episode, let me know what you think in the comments. And with that being said, let's get the show started.
Welcome aboard Middle East Airlines.
والمتوجهة إلى
طيران الشرق الأوسط يرحب
مدينة القدس العربية.
Christina, the way that we always start this off is self-introduction. Before we get into the topic, I want you to introduce yourself in the way that you see yourself. So when Christina looks at herself in the mirror, who does she see?
That's a hard question. So when I look at myself in the mirror, I see someone who is resilient, motivated, determined, but still evolving. Learning as I go as well with certain aspects of life. I mean, we change as we get older. I'm not the same person I was when I was in my 20s, and I don't expect to be, inshallah, the same person in my 60s. So I see a lot of growth when I look in the mirror.
Resilience is a tricky one, because to say that you're resilient, that means you acknowledge that you've gone through a lot.
Yes.
And I think when we go through our lives day to day, we don't realize that we are going through a lot.
Until you look back,
Yeah.
right?
Yeah.
In the moment, and you look back and you say, wow, I did that. And I don't mean to sound, arrogant in any way, but it's growth, I'm a mom of 3, got married age 18, had Mustafa at 19, then went to school. So yeah, I've done a lot. Alhamdulillah, I'm very blessed.
Wow.
But you look back and you're like, how did I do it? I don't know how I did it, but alhamdulillah.
We underestimate ourselves and what we're capable of.
For sure.
Especially in the moment. Like if you tell now an 18-year-old, you have to get married now, you're going to get a kid after a year, and then you have to go into school, and she's going to tell you, this is not something that I'm capable of doing. But in reality, she's capable of more than that too.
Absolutely. But, I'm not saying that would I want my daughter to do the same thing? I don't know. I can't tell you that I would. It wasn't easy. My husband's not the same person he was. I'm not the same person I was. But I think now there's a shift where they're both going to school together and then starting to have a family. But yeah, I don't think that now this generation is the same that it was back then, to be quite honest with you.
Okay. If someone just randomly pressed on this episode, by mistake or they were just curious, what's one thing that you can tell them that makes them want to continue listening till the end?
You are not broken. You have to be heard and seen in order for you to feel better. It's important to get to the root cause of what you're feeling and why you're feeling it. And you have to be your own advocate. You truly have to advocate for yourself and educate yourself and seek the care that you truly need, especially during midlife, for both men and women.
The topic of hormones, perimenopause, menopause. Correct. I didn't know there was a term called perimenopause until we spoke, and then you said we should talk about perimenopause and menopause. And I'm like, what's the difference?
Correct.
And so, other than people not knowing about these things, PCOS is a big topic as well. But while I was looking into it, there's a lot of environmental factors that go into these things, and I have this tendency that I want to look at it through our environment as Arab, Muslims, immigrants, because our experiences are unique and there's a lot of difficulty and trauma that comes with that. So the first thing I think of, how did our culture kind of feed into these problems?
I see it in practice all the time where women are having these symptoms. Like I said, they're feeling tired. They can't sleep. We contribute it to life stressors. So we're raising kids, we're mothers, we're daughters, we're sisters, we're friends. Some of us are employees. Some of us are entrepreneurs. We wear many different hats, and we contribute the things that we're experiencing to that. I mean, we have some strong women in our community, so we're capable of doing all of these things. So I'm just going to have to deal with this because I can do this. So me not sleeping or me feeling tired or me, having it affect my relationships in my life, it's just going to have to be the way that is because I have to take care of everybody else around me, which is fine. You can't fill from an empty cup. And that's where the shift kind of needs to change, whether it be hormone replacement therapy or the way that we take care of ourselves in our 20s, in our 30s. So what am I doing now for later when I go through that change, when I go through perimenopause or when I go through menopause? It's never too early to start learning about what to expect. So I think that to none of our faults as women or as providers, I think perimenopause and menopause was a slide that I brushed over in NP school for 30 seconds. I kid you not. 30 seconds. And I do believe that in medical school, there's not that much focus on perimenopause and menopause either. So I think that we've accustomed it to life. Life is stressful and we just have to deal with it. It's a change that's going to happen. This is normal. And you're going to go through it. So it can start as early as age 35.
The things you explained kind of talk about like in general what women go through. I want to go deeper into the specifics of even us as Arabs, as Muslims. Like when you say, or when someone hears their hormones all over the place, first I feel like growing up hormones was just something associated to women. Like men don't have hormones. And even when those got brought up, it was taboo.
Yes.
In a way, which is weird, right? Especially like growing up and knowing everything about hormones. It's like this is the basic 101 functions of your body.
Correct.
So why do you think there's such a taboo topic?
I think that some of the symptoms that women experience in perimenopause, or even men who have a deficiency in certain hormones, I think the taboo might come from, it has a lot to do with, for example, the hormones progesterone, estrogen, and testosterone are sex hormones. So if somebody hears that word, they may think, we don't need to talk about this. Why are we talking about this? So if a woman is having issues with intimacy or it's affecting her relationship, it's not something that she's going to talk about. It's going to be looked down upon. Why are you talking about this? Why are you asking about this?
How does someone with hormone deficiency or just issues with their hormones detect it?
That's a very broad question. It
Okay.
can be very different for every woman. So let me start by differentiating menopause and perimenopause.
Okay.
Okay. Menopause is when a woman has completely stopped having a menses every month. It's gone a complete year. So even it's been 9 months and she has a menses, she starts that clock over again. Prior to that, we can start at as early, average age for menopause around 52. It can start as early as age 35.
15 years before?
15 years. So women spend, possibly, give or take, of course, again, every woman is different, the last 30 to 40 years of their lives feeling like something isn't right. Tired, can't sleep, can't think, brain fog, decrease in unable to lose weight. They feel like they're gaining weight no matter what they do. They're doing everything right. They're eating right. They're exercising. I've heard symptoms even that itching in the ears, itching all over the body. So there's a whole array of symptoms that women notice, but they contribute it to other things. I'm getting older. Okay. So in my practice, usually when a woman comes in, she's done her homework. She's had her physical, she's had her blood work, and she's been told everything is normal, exercise, eat healthy, and you'll be fine. And it happens over and over and over again. And then some symptoms just worsen. Not to mention the preventative aspect of hormones and how they work in preventing other chronic conditions. So there's little triggers that women will start. Hot flashes, that's a big one, but perimenopause isn't just hot flashes. So you can be having the lack of sleep or the anxiety or the brain fog and not have hot flashes, where some women are sleeping just fine, but they're tired and they're having hot flashes. So it can be very different for every woman's experience.
And that's difficult because those are anxiety can come from anything.
Yes,
right?
Absolutely.
Like day-to-day problems at work or at home or with your spouse, you can start having anxiety, you'll sleep a little less.
For sure.
You feel a little tired. You might maybe overeat, but not enough to gain weight, but you gain a lot of, you gain weight, like you said.
When you've ruled everything else out and, the woman isn't having other contributing factors, because fatigue can come from iron deficiency. Fatigue can come from a low vitamin D. Fatigue can come from issues with the thyroid, which is a big thing that goes unaddressed. So we have to rule all of that out first, but they are all connected, not to mention all the endocrine disruptors we have around us.
Like what?
The food that we eat, the clothes that we wear, the bottle of water that we drink, the laundry detergent that we use, the soap that we use. If you think about it, Allah subhanahu wa ta'ala, He created us not to sit behind a desk, not to use, and I'm not perfect, by the way. I preach this to myself as much as I do to others. We weren't created for the lifestyle that we have. So we kind of have to shift it to try our best to make up for all the disruptors that we have around us. If you think about it, back in the 1950s, before that, I think prior, it wasn't until the 1970s, doctors treated patients based on how they feel, not on a lab number. So they would dose medications based on how the patient's feeling. Are you feeling better? No, a little bit. Oh, okay, let's increase your dose. It wasn't until the 1950s to 1970s that there was that shift. Oh, this is a normal level. So this is where you need to be. Normal doesn't mean optimal.
Interesting. So before the 1950s, if I was sick and I went to a doctor, he would give me the dosage based off of how sick I am?
Mm-hmm. Based off of what you're feeling.
Okay.
Yeah. So things were treated based off of symptoms. But now we have a range, right? Okay, your vitamin D range is 30 to 100. You're at 32. You're great. No,
Okay.
you're not. You need to get up there.
Because
up to
I don't
100.
feel good.
Yes, because you don't feel good. So, and that's a whole nother issue that, we have, but nonetheless, personally, not medically, what are you doing in your lifestyle? Are you moving? Are you trying to eat well-balanced meals? Are you helping to prevent chronic conditions from happening later on in life, such as osteoporosis, heart disease, Alzheimer's, and dementia? And all of these hormones can, they affect that. So as we age, aren't we more at risk for certain conditions?
Right.
Yes, but why? Because there's a decline in our hormones as well. So, and that's where the hormone replacement comes in.
How did conventional medicine fail us?
So in 2002, there was the Women's Health Initiative. Women were given hormone replacement therapy, and I'm going to differentiate between the two. You have synthetic, which I don't like to use it because both synthetic and bioidentical are both made in a lab. However, bioidentical comes down to the chemical structure. The bioidentical hormone is closest to the hormone that our body makes. Okay, synthetic is not. So
what's synthetic then?
Synthetic, for example, synthetic estrogen that was used in the Women's Health Initiative, Premarin, and the other word is Prempro, which is agestin, progesterone, and estrogen. I know it's a lot, but is from pregnant horse urine. Whereas bioidentical hormones come from, like estrogen will come from yams, plant-based.
And you said pregnant horse urine?
Yes, they did. Yeah.
Okay.
So, and I'm not saying, so they used that and they said it increases the risk of breast cancer, heart disease, stroke. The women in the study, their other chronic conditions were not taken into consideration. If they had breast cancer or had heart disease, their age, the median age, I believe, was 63. Okay. Whereas menopausal symptoms, perimenopausal symptoms can start as early as age 35. Okay. So synthetic hormones, yes, it does increase your risk, but not bioidentical hormones. I have yet to find a study that shows giving bioidentical hormones to a woman in perimenopause will increase the risk of stroke, cancer, and heart disease. Now, keep in mind that life doesn't go on. I can't tell you that in 10 years I won't get breast cancer. But I know from the studies and from the literature, from the evidence-based literature, it's not because of a bioidentical hormone. So you can't patent a bioidentical hormone.
Why don't they just give bioidentical hormones?
Because you can't patent a bioidentical hormone. So synthetic hormones, like I said, Prempro, those are what are found in birth control pills. So you have a woman who has PCOS, let's give her birth control pills for 10 to 15 years, and then she wants to get married, and she wants to have a family. And we've given them 10 to 15 years worth of synthetic hormones. Why are we doing this?
Why would they give someone with PCOS birth control pills?
To help with the symptoms that they're experiencing.
And that are what? What is PCOS?
PCOS is polycystic ovarian syndrome.
Okay.
But that does not mean that a woman will have cysts on her ovaries. Again, a very broad condition, mainly insulin resistance, meaning an increase in blood sugars. Okay? So think of insulin as a key. It opens the cell to let the sugar from your blood get into the cell.
Okay.
With PCOS, the key's rusty. It's not working well. So you got all that sugar sitting in your blood, causing increased risk for prediabetes or diabetes, causing weight gain, causing inflammation throughout the body. Inflammation throughout the body, therefore, causes increased risks of having other complications, such as when you have an increase in insulin resistance, you have more visceral fat. Visceral fat is the fat that surrounds the organs in the middle of your body. That
Belly
visceral fat, that visceral fat causes inflammation, so it can increase risk of cancer. Okay, the cells proliferate, it can increase risk of cancer. It will cause an increased risk of diabetes. It will cause an increased risk of high blood pressure. It will cause an increased risk of high cholesterol. We have to treat the insulin resistance with lifestyle. Medications can be used and, successfully, but we don't have to go to birth control. So usually they would give the birth control to regulate their periods.
But why wouldn't they give them insulin if that's the problem?
They don't need insulin. They're just resistance. So how do you control the insulin resistance? First and foremost, diet and exercise. If it's not hunted, picked from a tree, growing in a garden, you shouldn't be eating it. If it's in a box or a bag, processed, sugar, you shouldn't be eating it. And they'll see, like I have patients in practice who will wear a glucose monitor to monitor what foods will increase their sugars, what's spiking their sugars in their blood, so that they know what they should avoid, because they're an exception to the rule. You and I may eat berries, which are usually the best type of fruit to eat, I guess you could say, and it's great. But I had a patient who was eating berries and it was spiking her blood sugar, but the white potato was not. So they're very different in the way that they're treated. They're a very, I've come to the conclusion that every woman has PCOS until proven otherwise. Honestly, I really have.
How do you prove it otherwise?
If she's not having any of those symptoms, because once you fix insulin resistance and visceral fat in every human being, you've improved their quality of life.
Why did I think they were cysts on the ovaries?
Because you can have cysts on your ovaries,
Okay.
but you don't have to have cysts on your ovaries. Usually, women or younger girls will complain of acne, excess hair growth on their chin or on their face, or difficulty losing weight. They're inflamed. They're having irregular periods. They have very bad menstrual cramps. Very bad menstrual cramps. I mean, I have patients who they're out. They're off of school. They're off of work. Those are signs of PCOS. Not to mention later on the issues with infertility. Difficulty getting pregnant.
How does PCOS affect infertility?
So when you have a woman who has PCOS, she gets pregnant and continues to have miscarriages.
Okay.
There's an issue with insulin resistance that you need to fix. There was a study conducted. You're familiar with the weight loss injections, Ozempic. There was a study that perimenopausal women who thought that they were done, they were in their 40s, went on this medication to lose weight. They were getting pregnant because you've decreased insulin resistance. So you've raised their chances of fertility. So once you decrease that insulin resistance, increase the metabolism of the body, the women have a better chance of getting pregnant. But again, progesterone plays a role in this as well. And this is a little bit technical, but women who have PCOS, don't women have phases throughout their month? They have a luteal phase defect. I don't know if you've ever heard of how are you feeling on your luteal phase? They're extra, irritated and uncomfortable, but they have a dysfunction there. They need progesterone. Hence why they're giving them birth control pills. But why are we giving birth control pills when we can give them progesterone?
Marketing and content creation has become a pillar of every single brand or business out there. You need it to stay in business. A big problem that business owners find is that they're too focused on their product or they're too focused on their service to be able to do that. That's why you need professionals that understand that world to go into your business and help you focus on your product, but at the same time, show what your brand is truly about and communicate that clearly to your audience. And that's exactly what we do at Keep Creating Media. We give you your time back and focusing on your business and focusing on your brand while we communicate to the world what you're all about. And because you're a listener of Not From Here, when you apply to Keep Creating and mention Not From Here on your application, you will get a discounted first month of services. Go to keepcreatingmedia.com or just hit the link in the description below. And now, back to the episode. So the simple way to do it is just give them progesterone, right?
It's case by case.
Okay.
It's not, PCOS is nothing simple.
And what
isn't.
What do birth control pills do exactly? So what's inside of that pill?
So birth control, depending on what type, it may only have progestin, which is synthetic. It's not progesterone, or estrogen, okay? Which is it's a synthetic form of estrogen. Okay. So a lot of times those are given to regulate a menses for a woman so that she can have a menstrual cycle every month. And a lot of times, even with the synthetic, they'll feel good. They'll feel better. But if we look at risk factors and we have something closest to what the body already makes, why are we using synthetic? And again, I don't really like the word synthetic because they're both in a lab, but it's the chemical structure of each and how they work.
I guess the body is kind of works on familiarity. So
Mm-hmm.
if you're giving the body a birth control pill every month, are the hormone level, like, is that deregulating the
So-
body in any way?
It
Or no?
might in certain ways. I'll tell you why in a second. But keep in mind that women who are young teenagers in their 20s on birth control, or even in general during that time, their hormone levels are all over the place.
Right.
Even perimenopausal women, their hormone levels are all over the place.
That's normal?
Yes.
Okay.
Yeah. But it's the issue with when you give the birth control pills, number one, the risk factors that we stated before, as well as they may, for example, I'll give you an example. A woman who is married on birth control, the birth control pills may suppress her testosterone, for example. Okay. So she therefore may not have any interest in being intimate with her spouse.
Testosterone for women.
Oh, yeah. You give women testosterone in perimenopause and menopause.
Okay. Because in my head, testosterone's for men.
No, it's for women too. Women's ovaries make testosterone.
Okay. And those are important
Absolutely.
for what exactly?
Testosterone, number one, muscle mass, even for women, decreases risk of osteoporosis because it helps with bone mineral density. It helps with energy. It is actually apoptotic to cancer cells, so it goes against those cancer cells. Women feel very good in my practice on testosterone. Mind you, they may have side effects, and I warn them. There might be slight side effects. I'm very particular on my dosage to avoid that, but my few who do come back and tell me, I'm not stopping my testosterone. Fix this however you need to, because your body has gone so long with, I don't have this androgen, I don't have this in my body, and then you give it, it's got to adjust. It's normal. For a few months, you might have some side effects.
Well, what are the side effects?
They might get some acne on their chin. Some may experience thinning of the hair or hair growth in certain areas. But it's about 20% of women that it happens to. But they're energized and they feel better. So fix this is basically what they tell me. Or if it's just a few months, I'm good. I'll deal with it and I'll continue with therapy.
I have a question about PCOS.
course.
How long can a woman go without realizing that she has PCOS?
A very long time. My perimenopausal women in my practice now, sometimes I'll look at them and say, do you know you had PCOS? Because there is a blood level. It's not a rule that every woman will have this fluctuation in their blood levels. And they're like, no. But then I'll ask them about, did you have this when you were younger? Did you have this? And then did you have that? And they didn't know until perimenopause. It doesn't go away in perimenopause, by the way. It can actually worsen. The insulin resistance worsen because now you're losing all your other hormones.
So what does it take to know if you have PCOS or not? Like confirm 100%?
There's no blood level that's going to 100% tell you have PCOS.
Oh, okay.
Can be diagnosed on symptoms. It's very common.
Like a
the
psychological disorder almost.
Not a psychological
No,
disorder.
like how they would.
Yeah. Yes.
Oh,
So if you
okay.
have a woman who is having difficulties losing weight, she's constantly inflamed, she's having acne, she's having hair growth in certain areas, PCOS. If she's having severe menstrual cramps, PCOS. There is a flip that happens on blood work that I usually see, and the flip can be very wide, it can be close, but there is something there that can show PCOS as well.
So if any woman listening right now wants to know if she has PCOS or not, blood work would be an important thing to do, but also like monitoring these symptoms that you're talking about? Like you can't self-diagnose yourself, correct? You would have to go see a professional?
You would have to go see a professional, but I do think that it's time to recognize your symptoms, first of all, that you're having and experiencing them, and talk to someone who will listen. Because a lot of times people aren't listening to these symptoms. So I'm having acne, I'm having this, I'm tired, my cramps are really bad.
Push through it.
Push through it. Exactly. So that needs to change. If one thing a woman who thinks she has PCOS can do, and she's not going to hurt herself if she does this anyway, is treating that insulin resistance, lifting weights, walking. If it's not hunted, picked in a garden, or grown on a tree shouldn't be eating it. They have apps actually that show like what are PCOS friendly and stuff. So it's that lifestyle shift that needs to happen first and foremost before anything. There are medications that are used. A lot of women sometimes don't tolerate them very well, but I've seen them used well in my practice. But first and foremost, it's lifestyle changes.
Correct me if this is not a proper question, but
Tfadal.
PCOS is insulin resistance. Isn't diabetes also insulin resistance? So how can you
You're at increased risk for diabetes.
what you said? Yeah, you said you're at increased risk for diabetes. That means PCOS leads to diabetes, but from your explanation, it seems like they're the same thing.
They're not the same thing.
Okay.
So again, it can be a very wide range of symptoms for women with PCOS. They may not be insulin resistant.
Okay.
But then you look at her cholesterol, triglycerides are a little bit on the higher end. You're like, what's going on? Why do I have a low good cholesterol, which I want that high? I want to keep my HDL high and my triglycerides low. And you're like, this is a 17-year-old girl. Why is this happening? PCOS. So when you have that insulin resistance and that increased risk, that's why it's so important to recognize it earlier and change your lifestyle. So what I do now as a teenager even, or in my 20s or in my 30s, I'm going to pay for later on in my 40s, 50s, and 60s.
I feel like a lot of women could be listening to this and they're in like their 20s, early 30s, and they're going to be like, I got like 10 more years before I can start worrying. I have to start worrying about this stuff. What do you say to them?
You're never too young. Read about it now. Be ready for the change that may or may not happen. It will happen, but you may or may not feel. Listen to your body. Educate yourself. There's a book called Estrogen Matters. I recommend it. It's actually homework for my patients. You can either listen to it on audio or read it. It's written by an oncologist, Dr. Avram Blooming, who treats women for breast cancer. His wife gets breast cancer, and she goes through menopause. And of course they say, oh, well, you had breast cancer. You can't have hormones. And she tells him, I don't want to live. Like, if you don't give me hormones, I don't want to live. And that led him down the road of revamping the Women's Health Initiative. And there are a few things I disagree with in regard to synthetic hormones, but all in all, it gives the explanation as to how the Women's Health Initiative just created chaos, panic, and confusion. And a whole generation of women just completely missed out. Our mothers, our grandmothers, they come in, I'm tired, I don't feel like doing anything, I'm not sleeping, my joints hurt. And I look at them and what am I doing? Like, well, what is this? This can't be normal that every woman is coming to me and saying this over and over and over again. So it's never too early.
And all they need is hormone therapy?
Mm-hmm.
How did they used to do it back in the day? Like back in the day.
What do you mean back?
I'm thinking, has this been just foreign language for centuries and we just figured out that women need hormone therapy?
Possibly. I can't tell you for sure how it was before, but I do know that now the endocrine disruptors are much different than what they were back in the day.
That makes sense.
Yeah, very much. So symptoms are happening earlier and earlier. So a man with testosterone replacement, how did we recognize that they need testosterone? We recognized that pretty quick.
Belly fat.
Belly fat, decreased drive, decrease in muscle mass, which, by the way, testosterone, it's not just about gaining muscles and all of that. It is essential for men. Mood, the way that they're carrying their weight, cancer prevention, it's very important for men, actually, testosterone.
Dr. Ahmed Hamoud was on here not too long ago, and he was talking about how when a man gains weight and his body just, there's more fat on his body, that fat lowers testosterone and higher estrogen. And to gain back that testosterone, you gotta lose the weight. And I didn't know that, and it's you can definitely feel it. when you're overweight and you start losing weight, all of a sudden you have this
100%.
like these weird bursts of energy out of nowhere that you're like what's happening to me? Like, why
Yes.
am I suddenly so energetic? And yeah,
And that's where the lifestyle comes in. But I'll tell you a little story. Testosterone, when it converts to estradiol, which is estrogen in a man. And that's where the magic happens. That's where you're getting the cardiac benefits and the cardio protection. It's that conversion of testosterone to estradiol. So it's essential.
Actually, now that we're saying this stuff out loud, I realize that like PCOS and like all these lifestyle factors that you're mentioning that would help in perimenopause and menopause, back in the day, they were living those lifestyles. The only things they were
100%.
eating
Exactly.
were hunted, picked from a plant or off the tree. And
He didn't make us for this.
yeah.
Truly. We sit at a desk for 7 to 8 hours. We don't move. So we have to make changes elsewhere. So if it's getting a standing desk or a walking pad or setting your alarm to get up and do a lap around the office, it's crucial. Not to mention the mental health aspect of exercising and moving. The endorphins, you feel good. I recommend to all my perimenopausal and menopausal women, put on a weighted vest and go for a walk. You don't need that jumping, hopping, running. I loved running. There's nothing like a runner's high, but my body didn't need that. I didn't need all of that inflammation. So lifting weights is essential for women in perimenopause. Before perimenopause. If you're going to start an exercise, lift weights. You will not look like a man. Lift heavy weights. You're saving your bones. You're saving your muscles. You're decreasing visceral fat. It's so crucial.
I never understood why women think that lifting weights would make them look too muscular.
I don't
Because like I see all these guys at the gym and they die like lifting 70 and 80 and 100 plus pounds, and they die to see results. But I don't know, like woman's perception is a 5-pound dumbbell or a 10-pound dumbbell is gonna make her look like the Hulk.
I think it's media, I guess. You know, you see a man lifting and what he looks like, and then you might see women who are what do they call them? Like performers who lift weights. That's a whole different ball game. So you're not going to look like that. You got to eat and do a lot of different type of hormone replacement, not the one we do for perimenopause and menopause, to look like that. You won't look like that.
But weighted vest is
100%.
Is it like kind of for both like cardio and like the muscular part? Is
Absolutely.
that why
So you're doing that strength training, you're doing that resistance training while walking.
Okay.
So it's crucial.
You know what? It's one thing that weirded me out looking into that it's like skincare and makeup. Also, some of them contribute to hormonal like deregulation in the body, or
Endocrine disruptors. Yeah, 100%. Everything that we use.
you would put them in that category.
Yeah, our makeup, our skincare, water bottle. I think nowadays even the air that we breathe. So what are we supposed to do? Go in a bubble? We can't do that. So we have to make up for it elsewhere.
You got to kind of work double. Like you have to do double the work.
It's work. Hormone replacement therapy, I always tell my patients, they're bullets, but they're not magic bullets. You have to do your part to feel even better. It's a crucial aspect of it. You know, a lot of times women are, and I see it, they start this journey. It can be overwhelming in the beginning. But the interesting thing is that everybody in the house starts changing too.
What do you mean?
As far as exercising. So then she's got her daughter looking into, what are you doing? What is all of this? She'll start changing the way that she eats. Or her husband will start seeing these changes. The husband, usually what happens is he sees how she's feeling. She's not agitated all the time. She's less fatigued. She's more pleasant. She's calmer. She's sleeping better. And then I end up treating the man. So
He comes for hormone therapy?
Yeah.
Wow.
Yeah. I love treating my husbands and wives. It's truly rewarding when a woman can tell you, I feel like myself. That's all they want. I want to feel like myself.
That's disheartening in a way.
Very much so. And that is the biggest reward, is when a woman can tell me, I feel like myself. And listen, it's a process. It can take time. I tell my patients it can take up to a year to regulate your hormones. When I'm checking in a few weeks later, they're like, well, 1, 2, 3. And I'm like, wow. But everybody's different.
So what you do in hormone therapy, what is it exactly? Like if I come now and I tell you, Christina, I want to, first, do I tell you that I want hormone therapy, or do you tell me that I need hormone therapy? Like, could you just tell me you just need to do these lifestyle changes? You don't need the whole hormone therapy. Is that a possibility? Or usually we always need hormone therapy?
Depending on that specific person, their medical history, what they're feeling, what their current lifestyle is, all of those play a role first. So I will have young men, tell me they want testosterone therapy. No, go change your lifestyle first. Men can possibly go through a midlife change as well. They call it andropause. So that's different.
What's that?
Kind of like when men, their testosterone levels start to decrease. I'm not going to give a certain age, but midlife, I would say. It just depends. But if you have a man who's doing all the right things, they're early 50s, late 40s, and they're experiencing these symptoms, absolutely, I will give them testosterone.
It's called andropause?
Yeah.
Okay.
Yes.
So what are you giving the woman that's coming for hormone therapy?
Depends on the patient.
Okay.
Depends on what she needs. I'll treat women for, their perimenopause and menopause, but it's not a one size fits all. I do treat thyroid as well.
There's a psychological factor to when you reach that menopause age, and I am getting older. Like, this is a sign that I'm in like this next stage of life where I can't get kids anymore.
Yes.
And do you kind of see that disrupting like their peace, because no one wants to get older?
Yeah. So acknowledging that, okay, and I just turned 40 recently, and I thought, wow, I'm probably I could die tomorrow, but I'm probably more than halfway done. It hits you. Like, what if you reflect and, okay, what did I do the last 40 years? Like, did I do it right? So how much time do I have left for relationships, for success, for, what am I, that's it? Did I waste 40 years? Women think that way. So when they realize that, okay, things are changing, and a lot of times women will, no, it's too early for me, which is fine. I thought it was too early for me. But when you acknowledge that there has been a shift and you're doing everything that you need to do to feel better, it can take some work to accept that, okay, I maybe I need hormone replacement. And I get it all the time. Is this a forever thing? Do I have to do this forever? It's not an antibiotic where I'm going to give you an antibiotic and perimenopause is going to go away. It's not going anywhere. But nothing will happen. It'll just go back to the way you were feeling before. So it's very difficult, to answer your question. It is a very difficult topic for women.
Are those concerns that come up?
Yes.
And in your office?
Yeah, emotionally, physically, because everything changes. A woman's body weight will shift and everything goes to the midsection, and she's like, what happened? Like, I was doing great. So it can be very difficult. It's a very sensitive topic. It can affect relationships. If you think about it, a woman at that age, sometimes she's raising adolescents and young adults who are going through their own hormonal change. So you have a woman going through perimenopause and menopause while raising teenagers and young adults. It's a recipe for disaster. So it can be hard. You're dealing with all of these issues in life because life is lifing, and you cannot pour from an empty cup. But we do it all the time because that's what we're expected to do.
You're always expected to push through that
Yeah.
pain.
Yeah. So my experience was I was at the mosque for an event. I'm not going to share what it was. And I was sitting there. I had finished work. And I was sitting down and I could feel, I have a very slow resting heart rate. Okay. I could feel my heart beating and I'm like, why is my heart beating fast? Like, what did I do? Did I drink too much coffee? Did I eat today? I'm like, oh, I'm fine. I'm probably just a little anxious or something. And I'm talking to myself in my head while the sheikh was reading. And then I felt it going faster. And then I'm just like, okay, now it's pounding. And then I started to get dizzy. I said, okay, now my brain isn't perfusing. I'm going to pass out. So, and I'm thinking, why is this happening? How do I stop from passing out and embarrassing myself? I wasn't scared. I just knew my heart was beating too fast, so I wasn't getting oxygen to my brain. And now I'm looking, which cousin do I do I tap? And I fell.
You fell?
I fell. And, you know, I was fine. We make the worst patients, by the way, just to let you know. Providers make the worst patients. However, I am, you know, I'm very lucky to still be in the primary care field. I work at Dr. Saad's office in Dearborn. And so he did all the things, ordered all the orders, sent me to a specialist. And I remember being at this specific specialist who is an amazing physician and a colleague. And he assessed me and he said, you know, and even at the mosque, she's stressed. She has a lot going on. She needs to take it easy.
How old were you at the time?
This was last year. I was 39.
Oh.
38 or 38, I want to say.
Okay.
And palpitations are one of the biggest symptoms of perimenopause. Biggest symptoms of perimenopause. And so he came in, you know, Christina, you're doing a lot. You need to manage your stress. I think it's just anxiety. Make sure you're taking your vitamins. And he left the room and I sat there and I said, do I make my patients feel like this when I leave the room? Do I unintentionally make my women feel so defeated and so little?
Did you feel little?
I felt like I was stupid, like for even having that event or having that issue. And so it was at that moment that I'm like, okay, this is not right. This is not okay. And it led me down this road, that along with what I've experienced in clinic. So it can be different for everyone. And we say, she's stressed. She has a lot going on. No, I'm okay. Stress keeps me going. I know when I need to slow down. And if I needed to manage my anxiety or stress, I would, absolutely, 100%. But at that moment, I felt what was happening. My heart was pounding, literally. The palpitations were like nothing I had ever felt before. And I had eaten, I had worked out, I had drank my water. I was in clinic an hour ago. There was nothing different to my day. So, and these are the stories, similar stories that I hear all the time.
What was happening to you then?
I was just having palpitations and irregular heart rate. Cardiac cleared me. I had no heart issues. Never had an event since, but palpitations are one of the biggest symptoms of perimenopause. And we send them to cardiology and they have to get a cardiac workup and everything's fine. Make sure you drink enough water, which we should be drinking enough water, but nonetheless, it's what happens.
And so if someone walks into your office right now and they have those palpitations,
Mm-hmm.
what would you do then?
First, I have to rule out cardiac.
Of course.
Of course. So I would address all of the things. Once they've had a cardiac workup and nothing's going on there, what is your nutrition like? What is your water intake like? For me, I drink a lot of water. I am very attentive to how I eat, what I eat. I eat enough. So I know that I'm doing. So this is why it was so hard for me. So when a patient tells me I'm doing all of this, and we tend to say, but are you? But are you? I am. And I knew that 100%. There's no reason why I should have this issue right now. Unless I had drank a Red Bull, which I had not. Like I would share if I drank or took something that might have contributed to this because I wanted to know what happened. So then I would, yes, address perimenopause and menopause if everything else has been ruled out.
So if we were to like make this a small list of things to rule out or like a checklist to know.
What do you mean?
Like, see how you said that when someone walks in, you rule out the cardio issue. Then, okay, water. And then, okay, how's your nutrition like? And then how's your exercise like? Like, is there a checklist that like a woman can go through to know between her and herself? Like whether it's perimenopause or if it's PCOS, like is it, I'm just trying to think, because a lot of these things are weird and they happen out of nowhere.
Yeah.
And like PCOS, it's like this self-diagnose. Like it's also a little weird. So like, is there a checklist that you kind of use off the top of your head that people can go through?
Obviously, there's always the big ones. In the end, I started as a cardiac nurse. So is the heart okay? Are the electrolytes okay? Are the kidneys okay? Is the liver okay? Is the brain okay? Like, you literally do in your head a physical assessment of everything, addressing everything. You look at blood work. You have to address anxiety and depression. So is the anxiety and depression need to be addressed, or is it the lack of progesterone that's caused us this new onset of anxiety at age 42? So it's very tricky. I'm not opposed to treating anxiety and depression with medications, but for me now it's, okay, this came at age 42, 43. I know that there's a decline in progesterone. Instead of giving the SSRI, why can't I try progesterone first, which is a bioidentical hormone that the body naturally makes to help this woman sleep, to decrease her anxiety, and to turn off her brain at night. I used to solve problems while I slept. I would literally wake up and tell my husband, you know what I was thinking while I was sleeping? And he would just look at me like I was crazy.
Yeah, what does that mean?
I would solve problems while I was asleep. I could not turn my brain off. I can't turn it off. Melatonin, tried it all. And the first night I slept, I woke up thinking, and it's not perfect, I woke up a few times that night, but when I was asleep, I was asleep. I dreamt, and I'm like, oh my God, I dreamt. I don't dream. So you're functioning on zero. You're dealing with life. You're experiencing all these experiences, even if you're doing everything right, and you go to get help and everything's normal.
You're going to realize through this conversation with Christina, there's one thing that always comes up is listen to your body. How is your body feeling? You know, it's a very integral part of this conversation and the reason why people do hormone therapy or do these lifestyle changes. And although there's a bunch of different ways that people track their health and their body, the best wearable device that does that, in my opinion, is Whoop. Whoop gives your body a recovery score every single day, telling you how well rested and recovered your body is. And it uses many different health vitals to do that. And one thing that I've heard from people that have been using Whoop for a long time is that score is usually always true. They look at the number, they see how they feel, and there's a positive correlation every single time. And Whoop has a special offer because you listen to the Not From Here podcast. If you go to join.whoop.com/notfromhere, you're able to try Whoop out for a month for free. That's join.whoop.com/notfromhere. And now back to the episode. But see, this is where like my head can't wrap. I can't wrap my head around the idea of if this is such a big issue and perimenopause and menopause and all these symptoms and why is that not an option when you go to the doctor?
I can only speak for myself. Okay. I shifted because of it. And I always tell everyone, if nothing came from this, besides the fact that I can treat myself and mine and those around me, I'm okay with that. I truly am. Because it's what we were taught. That's why. We were taught it's the system. You don't have to treat a woman in perimenopause. Let's give her medication for anxiety, which again, I am not against because there are instances where it's definitely needed in addition to hormone replacement. But we weren't taught to address it.
So it's just kind of this thing, even in the medical field, where this is just something that she has to go through. So let her go through it.
It's normal. It's a normal change of life. You need to go through it. You need to go through your lack of progesterone, estrogen, and testosterone and get osteoporosis by the time your age. We wait to do a bone scan at age 65. Oh, you got osteoporosis. Be careful. Don't have a fracture. Why do we wait till age 65 to do a bone scan on women? And why don't we give them hormone replacement therapy to prevent osteoporosis? which is thinning of the bone. Look at our moms and our aunts with their little, their osteoporosis. How did we get here?
Is it ever too late to take hormone therapy?
In my opinion, no. There are providers that will say it is. They say that once you've been there, they talk of the 10-year mark, that if you've been in menopause for 10 or greater years, no. But for me and how I treat my patients, and again, it's an open conversation with my patients. I present the literature and the evidence in front of them, and they can decide, if that's something for them. But for me and mine, no, it's not too late.
Why do you think it's not too late?
Because I've seen the evidence. Because I've read the articles and I've seen the research.
Is it ever too young to do hormone replacement therapy?
Yes and no. So, for example, usually like I said, you can have symptoms at age 35 for perimenopause, but a lot of times I need to treat the PCOS first. For men, if you're a man coming in for hormone replacement therapy in your 30s, I need you to change your lifestyle first. There are certain instances where, okay, maybe, but nonetheless, I have other options. So a lot of men still want to have kids, right? So if you give them testosterone too early, it might affect fertility. That's why it's midlife, mid-age. Men are usually done having kids.
What are the lifestyle changes that they have to do?
Well-balanced meals, increasing protein, and movement. Movement is medicine. That is crucial to men. And it's intaking your protein, decreasing bread, rice, potato, sweets, and pasta, all the good things. I'm not saying eliminate. You need your carbs. You need your good carbs. You need it for energy. But those are the things that increase insulin resistance.
Would that nutritional advice be different for women?
No, it's the same thing.
Same exact thing?
Same thing. Yeah.
Okay.
Also, thyroid is a big thing for women with PCOS. Thyroid is a big one. So you are diagnosed with a history of hypothyroidism. You have that antibody that shows you have hypothyroidism. And women, usually at midlife, they're on their Synthroid, which is T4. Keep that in mind. You go to the doctor, they test your T4 and TSH, you're good. She's still having fatigue. She's still having constipation. She's still having dry skin. So those are all symptoms of hypothyroid. Okay? T3 is what's metabolically active at the cellular level. That's what gives you your energy. There's a book called Rethinking Hypothyroidism. Amazing book. But why aren't we giving T3? Pharmaceuticals. T4 is Synthroid. We have to wait for T4 to convert to T3. Why do we have to wait for T4? And as we get older, that conversion declines.
Can you just give T3 then?
Yes. You give T3 not alone. You have to give it with T4 because you don't want to suppress that. So for my patients, they're given a combination of T1, T2, T3, and T4. So the other thing is normal isn't optimal, right? Those ranges that are given in the lab. So I'll give you an example. A woman in her, let's say 30s or 20s, her normal testosterone level, let's say estrogen level is, 30, just for sake of numbers. At 60, the normal is 0. What? Oh, it's normal at that age. But she feels the deficiency of estrogen. So why aren't we giving her that? Why aren't we giving her estradiol? Same thing goes with the thyroid. The normal level for a teenager is not the same normal level for you and I, but it's not optimal. How do you feel? How do you feel? When I treat my clients, my patients, I treat the way that they feel. I will look at numbers to get an idea. Are they taking it correctly? Are they eating foods with their vitamin D for it to absorb? Like a fatty meal with their vitamin D. I use it as a guide, but ultimately, I go by how my patient feels.
What are the things that the thyroid affects in a woman?
Everything. Metabolism, weight gain, brain fog, fatigue. It's all connected. So you have now perimenopause, and then you have issues with the thyroid. So a lot of times, typically, and again, every woman is different, and I treat every woman differently. Every patient is a snowflake in my book. Most of them are on progesterone, testosterone, and thyroid. Estrogen, I do later. I don't do right away.
Because even like the thyroid, it has to do with like your mental health as well.
Yes. The brain fog, the forgetfulness, it plays a big role in it.
Like one of the guest doctor, Ahmed Anene, he's a naturopathic doctor. And he was telling me about this patient that he had that was depressed and almost suicidal. But treating the thyroid made him go back to normal.
Yes. The thyroid affects everything. So for my women in PCOS, and my women who have PCOS that see me at my Has practice, I will optimize their thyroid to help them to get pregnant.
It also affects that.
They have a dysfunction.
With PCOS, perimenopause, and menopause, does it help looking at your mother or grandmother? Is there hereditary aspect?
PCOS is definitely, it's genetics. It can
Okay.
be genetics. It's not rule that your mom has to have PCOS for you to have PCOS, but it is genetics.
What about the perimenopause and menopausal symptoms?
You're going to go through it one way or another. How your symptoms are, it's not really, it can be, but it may not be. Like I have women who, their moms, they're just always walking around with a fan, always.
Yeah, you see those symptoms, yeah.
Yeah, but then the daughters are like, I'm just anxious, and there's this sense of, I can't turn it off. That's one of the biggest things women tell me, I can't turn it off. So it affects them greatly in their relationships, in their life, in their work, and everything.
The thing that surprised me the most from everything that you said is we've heard and seen our mothers or grandmothers go through these phases, and now like you're not saying that they're not going to go through these symptoms, but from what I'm understanding is they don't have to go through them in the way that they already have been for the longest time.
Aging is normal, but it doesn't have to be difficult or miserable. It truly does not. It's just personalizing care for that woman or man to help them for longevity. Again, it's all about longevity. If we change the mindset from vanity to how is this one body that Allah subhanahu wa ta'ala gave me going to last me through my life? So I can lift my grandkids, so I can play with my grandkids, so I can carry my own suitcases, so I stay out of the nursing home.
And just feel better.
Yeah.
Like I can't imagine walking around life feeling depressed 24/7 or feeling that you can't recollect a thought. Like that will destroy you.
Yeah, some women just don't want to go anywhere anymore. They don't want to see anybody. They don't want to be around anybody. It affects them tremendously. Some women's hot flashes are so bad that they will not leave because they don't want to be embarrassed and be soaking in sweat in a restaurant. Literally. I had a woman who went on vacation and she forgot her hormones at home. She went up north. Her husband drove back and got them for her and took them back. She was only there for 3 days. But she was not willing to go back there. She was not willing by any means.
Are they pills?
Depends on what it is. Some are creams, some are pills. Just depends. Everyone's different.
Especially that, like, I don't know. I feel like when, like, the woman's inside of her own house, let's say she's 45 and she's just mostly inside of her own house, like, these things happen, but to a certain extent, there's this type of her being comfortable because it's her house. But now you have women that are working in like offices and high position jobs, and now she's getting the brain fog and her performance at work.
Can you imagine with a group of women working together going through perimenopause or menopause, what that can be like?
Yeah.
We wear many hats. So it will affect their work. It will affect their relationships. It will affect their performance. It may not in that way. It just depends.
Where do you think like the push through it talk came about? Because it's weird if you think about it, the women are the more delicate gender.
Yeah, right?
Right? And you would, like, they say this stuff to man, like, just push through it, push through it. But I wonder where it came.
I think culturally,
Cultural?
maybe.
Yeah.
I think it is culturally because we have some amazing women in our community, strong-willed women. So we're expected to be the same way by any means, but those older women aren't sharing their struggles, whether it be even with their relationship with their husband, even in that age. It is not easy. It's not easy to watch.
What's one thing that we didn't talk about today that you think we should have?
I think we covered it in a nutshell. I can go on and on for hours, but in a nutshell, I think we covered it. I think if anyone takes one thing away from this, it's to find someone that will listen. Your symptoms are real. It's not you. You're not broken. Your body is giving you a signal that something is off. You're not doing anything wrong. Something is off in your body, whether that be you need to change something that you're doing, or you need hormone replacement therapy, or something as simple as needing more water or vitamin D. Your symptoms are real and they need to be addressed.
You know, I keep thinking about what you said at the beginning of the episode where, and like before the 1950s, they would see how the person felt and they would go based off that. And I didn't even realize that now it's not like that. I remember when I got my blood work done, they were like, yeah, this is normal range, normal range, normal range, normal range. And then that's it.
Your vitamin D is low, but that's normal. No,
Yeah,
it's not
exactly.
normal. It's common. It's not normal. You need your vitamin D. Mood, energy, bone.
What do you think about supplements?
What kind of supplement?
Like the vitamin supplements.
100% vitamin D, crucial, especially here. We live in Michigan. We don't see the sun. And a lot of women don't have a very big surface area seeing the sun either.
Right.
So I'm for the supplements when used correctly. Magnesium is a big one too. All my women are on magnesium with sleep, with their progesterone.
Okay, so magnesium is for them to sleep better?
To help with sleep. There's different types of magnesium, so you have to be careful which one because they might affect different things. But yes, it's funny. We had this conversation the other day because somebody was making fun of me filling my supplements. I don't take a medication, but all of my supplements. And this is where I want to invest my time, energy, and money, is my longevity. So I think if we change it again from vanity to longevity, I think hopefully, inshallah, our kids will do better.
All of this I wanted to say is going back to the same point as how do you feel? How does your body feel? And one thing about what you went through is you knew it wasn't you that was the problem. Your body was telling you that something was up.
Yes.
You know? So, and I think we don't do that. We kind of just give in into whatever like the professional says, which of course in some points you should, but what's your body telling you?
Exactly. 100%. What is your body? What is it signaling to you that something needs to be addressed? So it's a very, can be very different for everyone, but it's acknowledging that there's a change that needs to be addressed, I think is a big thing.
Yeah. Thank you, Christina. This
You're
was
welcome.
great.
Thank you.